Alright, for this video, we're going to talk about the Biller module. So this is the module responsible for processing payment. And just like other dashboards, you get an overview start of new invoice, pending invoice, private invoice, HMO invoice, stroke claims, company invoices, stroke claims, all invoices, revenue generated for the day, and total transaction. And you can as well create new invoice, record payment, you can view report, and then you can also view HMO claims. All right, so quickly I'm going to navigate to invoice page, and you can see that we have this tab, this week, this month, costume range, and all invoices. So first off, the today's invoice start selected, which means you're only going to see the invoice generated for the current day. As you can see, we have one for Temi Tokbe. We'll be using this patient for this series. We've talked about so far the reception module, the nurse and doctor module, the lab and radiology module, and we've used this patient. So it's a private patient. As you can see, account type private, company registration, and then we can go ahead to, of course, access the contest menu by right clicking on the record. And here we can record payment, we can print invoice, you can edit invoice, and we can view details. We're going to quickly view details. So right here, as you can see, we have all of the services, all the tests, whatever has been prescribed for, test requested and just prescribed the whole year. So you can see when the patient registered, 30,000 naira was charged, which was paid for. The same with the appointment, and then the test that we did for the blood count and the CT scan. That we haven't done a prescription yet. That will be the next module we'll talk about. Then we've also done surgery and admission. So all of these are pending, and you might want to ask, so why was the service successful? Like, why were we able to proceed with carrying out those requests without the patient having to pay? So on the admin side, there's something. I'm just going to quickly show you what it is. So if I should, I'm going to duplicate my tab and then quickly go head over to the admin module, and then I will go to settings, and on settings I'll go to billing. So you can see that allow deferred payment for private patient. What this means is we allow patient to proceed with their tests, the prescription, and whatever service the hospital is rendering, and only bill them afterwards. So, and that's why all of those services went through. So if I had turned this off, those services would have required payment before proceeding. So right now I'm going to take a record. I can make full payment of this 1.2 million 47,100, or I can then maybe the patient say I don't need to pay for everything, but I want to pay for selected services. So you can come to select item and select the service the patient wants to make payment for. In this case, I'm just going to go ahead with a full payment, and the payment method will be bank transfer. So here I can put in the reference number, payment date, and some other details required, but I'm just going to use cash in this case. So I'm going to record payment and wait for that to process. So that has been processed successfully. You can see status has now been updated to paid, and outstanding is 0. So you can see that all of this has been paid for, and you can see payment history. So here I can reverse the payment, I can print the receipt, I can as well print the invoice. So once I click on that, of course I can see all of this, and then I can decide to either download or print the invoice. So I already talked about creation of invoices. So you just head over to the create invoice page. Alright, so here I'm going to search for a patient. I have David Suleiman Adeyemi, so I can select patient and then proceed, and you get a list of all of the services. You can search, you can filter by the service category. So maybe pharmacy, then you get all of the available drugs. Maybe investigation which are tests, you can as well search for whatever you want. So chest x-ray, I can click on that. I can change the amount. The amount doesn't be set for this test, but I can go ahead to set the amount, the quantity, and then we can proceed to next, and I select payment type, and once I'm satisfied, I can go ahead to create invoice, and then of course record payment. Then we have the payment page. So this is where you see all of the transaction. So you notice we paid 1.2 million for 7,100 naira. Here you can see that that payment is there. Status is successful. This payment of course can be reversed. You can right click to bring out the context menu, and you see the option to reverse or print receipt or view invoice.